Thanks very much for staying with us. Time now for Eye on Africa with me, Georgia Calvin-Smith. Tonight, the WHO warns that Zimbabwe cannot stop its efforts to tackle a malaria outbreak, even with the pressures of dealing with coronavirus. Malaria is still one of the country's biggest killers. Also, Burkina Faso and Ghana start to ease coronavirus measures, which comes as a relief for workers struggling to get by. But the number of cases continue to rise, and there fears the changes may have come too early. And wearing a mask in Gabon's capital is now compulsory, but for the majority of people, the protective gear is difficult to get a hold of. One of the many difficulties those with less means have to contend with as the country does what it can to prevent the spread of COVID-19. We take a closer look. But first, Zimbabwe's health system is being stretched even further by malaria outbreaks that have killed at least 131 people. On Tuesday, the country extended its coronavirus lockdown by another 2 weeks as it races to curb the spread of COVID-19, which has caused at least 3 deaths with 25 officially recorded cases. The World Health Organization said that despite the risks on that front, Zimbabwe shouldn't take its eye off the ball when it comes to managing malaria, which, though treatable, is still one of its biggest killers. Ryan Truscott tells us more.
The latest figures for malaria are worrying. More than 135,000 people infected over the last 4 months and 131 fatalities. That's certainly a lot more than the current caseload of coronavirus, which is just 25 confirmed cases, 3 of them fatal. Some of the symptoms of malaria are similar to those of COVID-19, things like headaches, body pains and fever. So when these malaria figures were announced by the Health Ministry earlier this week, it raised suspicions that these weren't malaria cases but were COVID-19 cases. Fact checkers say that actually these figures are well within what's possible for malaria. April is the peak season for the disease, and this year's figures are consistent with recent malaria trends here. Last year at this time we had more than 118,000 people infected and 118 deaths. But I think the worry this year is that patients in remote rural clinics might be misdiagnosed as having malaria when in fact they have COVID-19 or both, because malaria is a disease that can coexist with other ones. In fact, the second person here to die from COVID-19 was an elderly man in the southern city of Bulawayo. We understand he was in fact initially treated for malaria because he had recently visited a game park in the northwest of the country where there's known to be malaria, and it wasn't illogical for a doctor to suspect malaria in that case. But that did highlight the dangers of having outbreaks of both malaria and COVID-19 at the same time. The World Health Organization is warning African countries like Zimbabwe that their fight against malaria shouldn't be overlooked during the fight against COVID-19. It says that malaria is still expected to kill hundreds of thousands of people this year, so donors and public health authorities can't let their guard down.
Ryan Truscott there for us. Look now at some news in brief. Around 24 people are missing in Kenya and thousands have been forced from their homes because of flash floods. At least 12 people have died in a landslide triggered by the torrential rains. That happened at the borders of West Pokot and Elgeyo Marakwet counties. The town of Chezugon was totally submerged after a river burst its banks over the weekend. People living in at-risk areas have been told to move to higher ground. The extreme downpours are expected to continue until at least the end of the month. After having previously denied that troops were involved in the massacre of at least 13 people, including 10 children, Cameroon's now admitted that soldiers were responsible for the killings. They happened in an English-speaking region in the west of the country back in February. The bloodshed in Ngaba drew international condemnation. Rights organizations say that the attack is part of a larger pattern of brutality by Cameroonian security forces. The country's been dealing with an armed Anglophone insurgency since late 2017, with both sides accused of abusing civilians during the conflict. And Nigeria's apologized for the lack of social distancing at the funeral of the most high-profile person in the country to die of coronavirus. Abba Kyari, who was in his 70s, was the chief of staff of President Muhammadu Buhari. Pictures taken at his burial show dozens of attendees standing side by side around the grave. Officials have said that sent the wrong message to the nation as it tries to get a handle on cases of Covid-19. Nigeria so far has officially logged 665 cases and 22 deaths from the virus. And the Ugandan court has suspended a parliamentary decision to give MPs 20 million shillings each, which is around 5,000 euros, to help them fight the spread of coronavirus in their constituencies. The move sparked public outrage, with many critics saying that the money would be better spent if it went towards frontline health workers. The cash, which would have been given to lawmakers to fuel ambulances and pay allowances for drivers in district Covid-19 task forces. But there were concerns that many MPs were not in their constituencies because of lockdown. The suspension came after 2 opposition MPs challenged the allocation. Now, Burkina Faso and Ghana have started to ease coronavirus measures. That comes as a relief for some workers who've been struggling to get by under restrictions. But the number of cases continue to rise in both countries, and there fears the changes may have come too early. Take a look.
Social distancing was not respected when Burkina Faso's main market was reopened. It had been closed for nearly a month. Those who entered had to wear masks, wash their hands, and have their temperatures taken. The reopening was welcomed by traders. The government's critics said it had reopened the market too early. The country has more than 500 cases and the numbers are not dwindling. In neighbouring Ghana, the authorities have also ended the total lockdown in the country's biggest cities, Accra and Kumasi. The decision was taken despite the fact the country has more than 1,000 positive cases and the numbers are still rising. President Akufo-Addo said there would be increased testing and expanded isolation centres. But some Ghanaians, like this laptop repairer, are concerned.
I don't think this is the right time because you see the numbers keep increasing. And I think this is even the time that we have to put proper measures in place.
Akufo-Addo is facing a tough fight for re-election in December. The opposition accuses him of easing the restrictions too early, simply to keep the support of the poorest voters.
Wearing a mask in Gabon's capital is now compulsory, but for the majority of people, the protective gear is still difficult to get a hold of. It's one of many difficulties those with less means have to contend with as the country does what it can to prevent the spread of Covid-19. Our correspondents report.
Military roadblocks are set up to enforce the strictest confinement order in Gabon. In Libreville, movements between the different parts of the city are now prohibited, except for employees working in essential services maintained by the state. Those who do not own vehicles have to patiently wait for the bus shuttle service. At this bus station, it is almost impossible to enforce the social distancing of 1 meter between passengers. They are all eager to get on board after hours of hassle in a city where the taxi services have been suspended. Deprived of work and revenue for several days, taxi drivers like Mama fear they will not be able to pay the rent if the confinement lasts a few more weeks.
We taxi drivers depend on our daily earnings. If we don't work one day, we are broke. As long as we can drive, we can eat. We can't have savings with the cost of living in Libreville. Everything is expensive.
To protect its 800,000 inhabitants and avoid any further spread of the virus to the rest of the country, wearing a mask has been made compulsory in Libreville. But in the isolated capital, masks are hard to find in most pharmacies.
We don't have any left. The borders are closed at the moment, so we cannot be supplied. The masks we had were sold out to clients who want to protect themselves and their families.
While medical masks have become too expensive for the poorest, many of them now rely on these homemade masks. With her sewing machine, Rosie makes around 50 a day, selling them between 500 and 1,000 francs each. Even if these masks do not offer total protection against the virus, the seamstress says they are in high demand.
I will continue making them as long as there are orders. I will carry on. My young neighbour helps me when there is high demand. I do the sewing and she irons and does the packaging.
The confinement in Libreville is expected to last until April 27. Health authorities hope these measures will curb as much as possible the curve of contaminations with the new coronavirus.
Well, that's it for Eye on Africa for now. Thanks for joining us. Do so again. Take care.